Hello and welcome to Chapter 12 in Computers in Healthcare. We are going to cover standards in this chapter. This will be mostly a review from health records, so you are going to be extremely familiar with these concepts. So let's get started on page 204 in the text. A standard is a scientifically based statement of expected behavior against which structures, processes, and outcomes can be measured. Organizations of all kinds develop standards so that there is a uniformity in the products, tools, and technology that we use to perform almost all daily tasks, enhance performance of materials and products, and ensure consistency and quality of products. Because technology changes so quickly, standards should be technology neutral, meaning that they do not rely on any one type of technology in order to work. Standards must also be neutral to implementation processes which vary widely and not prefer one vendor over another. Standards can be made by a number of entities. Government bodies can create them and require their use. Technology companies can incorporate their own standards into the software and hardware products they sell. These are referred to as de facto standards because of their influence of the technology company in the market. Groups of HIT vendors can also create standards. For example, Digital Imaging and the Communication in Medicine, or DICOM, is a set of imaging standards developed by imaging manufacturers. The Office of the National Coordinator for Health Information Technology is responsible for coordinating and guiding the development and establishing of standards for HIT. The HITECH Act allowed billions of dollars for the development of standards. The ONC works with the standards development organizations to verify and corroborate standards that will benefit the EHR and electronic environment of healthcare at large. This chapter discusses the role of standards development organizations and categories of standards necessitated by the EHR, including data content, vocabulary, and messaging standards. So we're going to move on down to our standards development organizations, or SDOs. These are private or government organizations that create or approve standards at the national or international level. There are many SDOs for HIT and health information exchanges. Some are specific to the United States, some are international, and some are both. Usually an SDO develops standards for particular HIT software or hardware functions. For example, standards for interoperability allow health information from Mercy Hospital, who uses vendor A's EHR, to pass through an authorized health information organization and be read, used, and incorporated into vendor B's EHR at Valley Medical Center. Although each standard has value, some do not have an established best method or practice. Because of the many stakeholders involved in HIT, some standards overlap and can be interpreted differently by each stakeholder because they view the standard in a different context. For example, both HL7's Clinical Document Architecture, or the CDA, and the American Society for Testing and Materials, ASTM International's Continuity of Care Record, or the CCR, address the need for electronic transmission of pertinent and timely health information. However, CDA has a required core data set and mandatory text and coded components, while the CCR has a flexible format designed to permit easy creation by a physician using an electronic health record system at the end of the encounter. These two sets of standards conflicted until HL7 and ASTM worked together to create the Continuity of Care Document, the CCD. This standard addresses the competing and overlapping portions of their standards. Unfortunately, although standards are meant to allow a smooth exchange to meld and incorporate data from all sites, vendors, and specialties across the healthcare continuum, conflicting standards sometimes leave healthcare organizations struggling with interoperability issues. Interoperability, which we discussed in Chapter 11, is required in order to share and reuse data based on the demands of the new models of healthcare, population health surveillance, and customer-patient engagement. All right, so let's drop down to the International Standards Organization, or the ISO. The International Organization for Standardization is a large, widely recognized international SDO that has established many standards for EHR architecture and content. There are more than 22,000 standards for technology and manufacturing, and it takes approximately 3 years for the ISO to review and approve a standard. Some general areas of standards for HIT include the following: vocabulary and terminology. This is a specific set of values for a specific data type. Our examples are SNOMED CT and ICD-10. Then you have transport messaging. This is how information is sent and exchanged between systems, and our examples are TCP/IP and direct. Then we have security. This provides assurances that messages are protected. The ASTM Committee E31 on Healthcare Informatics has E31.25 Healthcare Data Management, Security, Confidentiality, and Privacy Standards, and that's our example. Then we have content. It identifies what data elements are included, where they are located, the data type, the field length, and so on. HL7, CDA, and ASCX12 are examples. And then we have technical. Usually a formal document that established uniform engineering or technical criteria, methods, processes, and practices. The American National Standards Institute, or ANSI, is the SDO for the United States and is a representative to the ISO. It is helpful to think of the ISO like the United Nations and its ambassadors from recognized countries. So ANSI is for the US, Standards Australia for Australia, and the Japanese Standards Association for Japan, for example. ANSI does not develop standards, but provides a neutral environment for organizations and entities to work together to settle on a common agreement for standards, the format, the content requirements, and more. The type of standards that have been developed include clinical data exchange, standard vocabulary, and document architecture that facilitates sending, receiving, and incorporating healthcare data into the EHR. But before a standard can be approved, it must meet the rules of ANSI and the following requirements. It must be made from consensus. It has due process, procedures, and specific committees that perform the critique, review the proposed standard, and eventually approve the proposed standard. Openness, transparency of all procedures to all parties. And balance, a platform for standards development that withstands scrutiny while protecting the rights and interests of all the members. Through ANSI, diverse stakeholders such as government agencies, private HIT companies, health insurance companies, and professional and trade organizations work together to develop standards. The stakeholders must be willing to compromise to develop consensus-based standards. Due process comes from the fact that standards development must occur in an open manner that is responsive to the needs of the stakeholders, and the development should be equitable, thus balancing the need of all of the stakeholders during the development process. The openness of standards development allows stakeholder representatives to participate in the development process. And the ISO has developed a 6-step process for organizations that request approval for the specified standards. Number 1 is the proposal. Stakeholders agree that there is a need for a particular standard. 2, preparatory. Draft and proposed standard is submitted. 3, committee. Draft is analyzed and revised by committee until consensus is reached. Number 4, inquiry. Proposed standard is available for review and comment by all stakeholders. 4, approval. The final draft is voted upon for approval. And number 6, publication. The standard is published. ASTM is an international SDO, well known in other areas of industry, but its healthcare aspect is only in the United States. The U.S. Division, Committee E31, addresses standards for healthcare data management, privacy, confidentiality, and security, as well as data analysis and the information capture and documentation. According to ASTM, its Committee E31 on Healthcare Informatics develops standards to help practitioners preserve and transfer accurate patient information using EHR technologies. Examples of the ASTM standards include the E2639 Continuity of Care and the E1384 EHR Content and Structure, which allows clinical laboratory data to be integrated with other patient information in an EHR by providing a comprehensive structure for the data collected. All right, so let's talk about our data content standards. Data content standards are clear guidelines for the acceptable values of specified data fields. These standards make it possible to exchange health information using electronic networks, and they identify the structure and content of data elements to be collected by the EHR. Data content standards allow organizations to collect data once and use it many times in many ways. They also assist in data storage and mining, as well as sharing data with external organizations for use in benchmarking and other purposes. The use of data content standards also assist in the HIE process. HL7, or Health Level 7 International, was founded in 1987 as a not-for-profit, ANSI-accredited SDO dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing, and retrieval of electronic health information that supports clinical practice and the management, delivery, and evaluation of health services. Its mission is to provide standards that empower global health data interoperability. And the National Committee on Health and Vital Statistics has recommended that HL7's messaging and clinical encounters terminology be used in all healthcare information systems. HL7 has developed standards for electronic exchange of clinical documents, such as discharge summaries and progress notes, referred to as a clinical document architecture. CDA uses HL7 XML-based document markup standards for the electronic exchange model for the creation of clinical documents, such as discharge summaries and progress notes. Implementation guidelines are included with each standard and define how to use specific standard for specific purposes. The implementation guide removes optionality. It states what data elements are required and when, so that there is no room for interpretation. Dropping down to that next paragraph. ASTM International created a continuity of care record, which identifies a core data set of patient information that must be passed on to the next healthcare provider in order to efficiently and effectively continue the patient's healthcare. The CCR was designed for all patient referrals and transfers. At the end of the admission or care encounter, the originating healthcare provider generates an electronic summary document with a core data set of the most pertinent health information of the patient's care and status for the receiving healthcare provider to continue the care for the patient. The core data set for the CCR contains the following: the document identifying information, the patient identifying information, insurance and financial information of the patient's health status, care documentation and plan recommendations, advance directives, and list of healthcare providers involved in care of the patient. All right, moving over to 207, the Continuity of Care Document, or the CCD, is an implementation guide for sharing continuity of care record patient summary data. It is the result of the joint effort of the ASTM International and HL7 and fosters interoperability of clinical data by allowing physicians to send electronic medical information to other providers without loss of meaning and enabling improvement of patient care. And it uses the HL7 version 3 Clinical Document Architecture Release 2. All right, moving on to vocabulary standards. Vocabulary standards, a list or collection of clinical words or phrases with their meanings, address the problem of multiple ways to define, classify, and represent language. Language generally refers to a system of communication using an arbitrary set of vocal sounds, written symbols, signs, or gestures in conventional ways with conventional meanings. Medicine has its own language. There are many terms used in medicine that can have multiple synonyms. For example, the terms medical and therapeutic, curative and drug, medication and pharmaceutical can be used relatively interchangeable. The use of synonyms can make it difficult to identify patients with a specific disease or condition. Several terms fall into the concept of vocabulary standards, including language, vocabulary, terminology, and nomenclature. So some of these should be very familiar to you from health records. Language is a system of communication used by a group of people. Vocabulary is all the terms that can be used for communication within the area of specialization. Terminology means the words used for a specific purpose, and a nomenclature is a system used to assign names. Vocabularies require terms to be evaluated for inclusion. Each term included in the vocabulary should have a unique meaning. However, it should be noted that synonyms are linked within the vocabulary, such as the examples we listed above. Terminologies in general are a set of terms representing the system of concepts of a particular subject field. A clinical terminology provides the proper context and usage of clinical words as names or symbols. Terminologies, along with the classification systems, are necessary to support the EHR, personal health record, and population health reporting as well as quality reporting. Vocabularies and terminologies can have overlapping terms due to synonyms and eponyms. This is one of the challenging aspects of medicine and the application of EHR and diagnostic software to interpret unstructured and sometimes structured text from a physician or a healthcare provider. All right, so let's talk about a nomenclature. This will be one that you are very familiar with. The most widely recognized nomenclature in healthcare is the Systemized Nomenclature of Medicine, or SNOMED. It was developed in 1975 by the College of American Pathologists, but maintenance was transitioned to the International Health Terminology Standards Development Organization in 2007. The current version, SNOMED CT, is the most comprehensive, multilingual clinical healthcare terminology in the world. SNOMED CT contributes to the improvement of patient care by underpinning the development of EHRs that record clinical information in ways that enable meaning-based retrieval. SNOMED CT is used for the EHR, research, and clinical decision. The information that SNOMED CT captures includes items such as diagnoses, procedures, signs, symptoms, and cause of injury. SNOMED CT has a concepts table that consists of more than 344,000 concepts, 450,000 medical descriptions, and 700,000 concept interrelations, each of which has a unique meaning and format definitions such as 98 degrees, and I'm saying the word degrees, versus 98 degrees with the degree symbol. All right, moving over to our next system, which is going to be LOINC. LOINC is also one you should remember. Logical Observation Identifier Names and Codes, or LOINC, is the preferred standardization or standardized terminology for laboratory data and information systems, and provides a standard set of codes and names for the electronic reporting of laboratory results. It was created in 1994 to assist in the electronic transmission of laboratory data between laboratories, care providers, and third-party payers. LOINC has expanded to include observational data such as vital signs, and is also used for standardized assessments and care plans in long-term care and home health. LOINC was not intended to share all data collected about a laboratory test, but instead to identify test results. The standardization allows the results from multiple laboratories to be easily understood. Our next one, RxNorm. This is another one you should be familiar with. RxNorm is a clinical drug nomenclature developed by the Food and Drug Administration, the Department of Veterans Affairs, and HL7 to provide standard names for clinical drugs and administered dose forms. It also provides normalized names for drugs and links names to commercial drug databases that are frequently used in pharmacy management and information systems and EHRs. It is non-proprietary and provides the standards for drug ingredients and strengths, as well as dose formats, drug properties, physiological effects, and therapeutic category. All right, our next one is the Unified Medical Language System, and we did discuss this one as well in health records. So, developed by the National Library of Medicine, the Unified Medical Language System is a program designed to build an automated system that can understand biomedical concepts, words and expressions, and their interrelationships, and it includes concepts and terms from many different vocabularies. To make these links, the UMLS uses more than 100 vocabularies, classifications, and terminologies. To understand how the UMLS helps to learn and understand the concepts in medicine, two concepts of how language works must be understood. These two key concepts of UMLS are semantics and syntax. Semantics is a branch of linguistics dealing with the study of meaning, including the ways meaning is structured in language and how changes in meanings and form occur over time. Syntax is described as the study of patterns of formation of sentences and phrases from words and the rules for the formation of grammatical sentences in a language. In other words, how words are sequenced can change the meaning of the phrase. For example, attending physician has a very different meaning than physician attending. The former being an adjective describing a type of physician, and the latter being a verb describing the action of the physician. The UMLS uses knowledge sources to help retrieve data across many databases. These knowledge sources are UMLS Metathesaurus, Specialist Lexicon, and UMLS Semantic Network. All right, dropping down to National Drug Codes. This one will be a new one for you. National drug codes were developed by the FDA to act as a universal unique identifier for human drugs. The NDC identifies the labeler or vendor, product, and trade package size. And you can see a table in 12.1 examples of national drug codes. So you have your drug and then you have your NDC over to the right. All right, moving over to page 210, we have current dental terminology. This one is a new one as well. This is a system used to code dental procedures such as tooth extractions, tooth implants, and such. The CDT was developed by the American Dental Association. It includes diagnostic, preventative, restorative, endodontics, periodontics, and other dental procedures. It is the coding system mandated by HIPAA for reporting dental procedures for billing purposes. Then we have medicine. It is a nomenclature and a knowledge-based system. It was developed by Peter S. Goltra and is now controlled by Medicomp Systems, Inc. It is the most comprehensive vocabulary for signs and symptoms. Medicine includes 250,000 clinical data elements that fall into the following categories: symptoms, health history, physical examination, test, diagnoses, and therapy. Then we have DSM. This is another one you should be familiar with. Diagnostic and Statistical Manual of Mental Disorders, or DSM, is a classification system of mental disorders used by mental health providers. It is published by the American Psychiatric Association. The current edition is known as DSM-5. The purpose of DSM-5 system is to assist physicians in properly diagnosing patients with mental health conditions. It is now linked to the implementation of the International Classification of Diseases 10th Revision Clinical Modification, or ICD-10-CM, in the U.S. The new format of ICD-10 codes was applied to the DSM-5 so that its release coincided with the implementation of ICD-10-CM. DSM-5 provides detailed and specific criteria and information in order for physicians to accurately diagnose the mental disorders of the patient. Along with this information, an ICD-10-CM code is provided. ICD-10-CM includes mental disorders and all other diagnoses, but it only provides a list of diagnostic codes and does not provide the detailed information about the diagnosis. All right, so now we're moving on to mapping. I think we talked a little bit about mapping and crosswalks and health records. When ICD-10 came about, there were so many more codes created than what we had in ICD-9. But you still had to know the equivalent of an ICD-9 code to an ICD-10 code. And so this is where mapping becomes very, very important. So to allow for interoperability, a crosswalk between various terminologies must be created. This crosswalk is called mapping, which is the process of associating concepts from one coding system with concepts from another coding system, and defining their equivalence in accordance with the documented rationale and a given purpose. An example of a map is a link between the code for acne in ICD-9-CM and the code for acne in ICD-10-CM. Before the map can be created, there must be an understanding of how the data will be used because the map must be consistent. Categories such as the following can be used in mapping. 1-to-1. This is an exact match between the systems. Then you have narrow to broad. A more granular term in the starting system maps to a more general term in the receiving system. So remember, granular means detailed. Then broad to narrow. A more general term in the starting system maps to a more granular term in the receiving system. And then fourth, we have unmappable. There is no matching into the receiving system. In order for this mapping to be performed correctly, individuals performing the mapping must have a complete understanding of how the data will be used. All right, so dropping down to the last paragraph on page 210, we're going to talk about general equivalence mappings, or GEMs. A common mapping system is general equivalence mappings. GEMs were created by the Centers for Medicare and Medicaid Services. GEMs are used to convert ICD-9-CM codes to ICD-10-CM or ICD-10-PCS codes, or the reverse. Because the two systems are not identical, the user would have to decide which code to select. Example, in ICD-9-CM, obstetrical codes record whether the condition was antepartum, postpartum, and so forth. But ICD-10-CM, obstetrical codes record trimester rather than antepartum and so forth. Because of this difference, there is no exact match. And you can see in table 12.2 on page 211 examples of mapping from ICD-9 to ICD-10. And so in this example, we're looking at a broad to narrow mapping because ICD-10 had one code, encephalocele. But in ICD-9 had one code. ICD-10, we see 5 codes listed here. Gets a little more granular. It gets more detailed. All right, dropping down to messaging standards on 211. Messaging standards may also be called interoperability standards or data exchange standards. The purpose of messaging standards is to support communication between information systems. With messaging standards, proprietary systems are able to talk one to another, allowing the exchange of data. Standards do this by mapping proprietary forms to other formats. Existing standards have allowed for flexibility, which has caused problems with the interoperability between systems. The ANSI Accredited Standards Committee, or we're going to call it ANSI ASC X12N, that's a mouthful. This is an insurance subcommittee that develops messaging standards for electronic data interchange, or EDI. EDI is the exchange of routine business transactions from one computer or information system to another in a standard format using standard communications protocols. ANSI ASC X12N was adopted by the HIPAA transactions and code sets. This standard is the messaging standard for many of the transactions covered by HIPAA, such as claims, eligibility inquiry and response, claim status inquiry and response, and payment and remittance advice. ASTM International develops standards for security, health record content, the continuity of care record, and the exchange of laboratory data. And examples of messaging standards include Health Level 7, DICOM, and the National Council for Prescription Drug Programs. Now, while HL7 is the most common application level standard for healthcare, there are other standards that are used for special purposes. So we're going to talk about DICOM. The Digital Imaging and Communications in Medicine DICOM standard retrieves images and other information from imaging equipment of a variety of different vendors. Areas covered by the standard include message exchange, data dictionary, data structure, and encoding. Although DICOM standards are started out in diagnostic medical imaging, it is broadened to include specialties such as cardiology, dentistry, and radiology. The use of DICOM standards allows images to be transferred between systems from different vendors, ultimately allowing imaging in the picture archival and communication systems to share information with clinical information systems and the EHR. Due to its popularity, DICOM has become an independent SDO and is ANSI accredited. ANSI Accredited Standards Committee X12N is responsible for developing the EDI standards used to share information needed for health insurance administrative transactions. These include functions such as benefit enrollment and maintenance, and health claim payment and advice. Work continues to increase more applications for the incorporation of health plans and additional privacy and security protocols due to the HIT challenges faced by many healthcare facilities. And last, the National Council of Prescription Drug Programs, the NCPDP, is an independent SDO, and is ANSI accredited. These standards were developed for and used by retail pharmacies and payers for claims, eligibility, and remittance advice. These e-prescription standards, called SCRIP, control data to be shared for new prescriptions, refills, and other communications between physicians and pharmacies. NCPDP is regulated under the Medicare Modernization Act of 2003, Medicare Part D e-prescribing. Okay, so that finishes up Chapter 12. Be sure again to read through your PowerPoint and again, read through the chapter. I expect a good bit of matching on this test. It will be a little bit similar to what we've done in the past with health records, along with some of your multiple choice questions. So happy reading and happy studying.